Hello dear learners, myself Bhavani Pentela, working as an assistant professor in Noida Institute of Engineering and Technology, Pharmacy Institute, Greater Noida. In the today lecture, we are going to discuss about the drug interaction on both pharmacokinetics and pharmacodynamics, which is in unit number 2 with the subject Pharmacology-I with the subject code BP404T. So, without any further delay, we will move into the class. And what is a drug interaction? So, in a previous class we had discussed about the adverse drug reaction, how many types of adverse drug reactions are there depending upon onset of action, depending upon severity, depending upon reactions. We had discussed each and every type of adverse drug reaction. In today's lecture we are going to discuss about the drug interaction. So, drug interaction, when the drug interaction will be happen, when the one drug is going to administer with the another drug, then the drug interaction will be going to happen. So, the drug interaction is due to because of when you are administering the two or more drugs in a same time. The drug interaction may be pharmacokinetics and the drug interaction may be pharmacodynamic. So, if you are talking about the types of drug interaction, the drug interactions are of many types: drug-drug interaction, drug-food interaction, chemical drug interaction, drug laboratory test interactions, drug disease interaction. If any particular person having the disease condition, if I taken the drug and disease state with the drug can causes the drug disease interaction. And now we will see the mechanism of drug action. The mechanism of drug action has been categorized into three types. One is pharmacokinetic drug interaction, pharmacodynamic drug interaction, and finally pharmaceutical drug interaction. So, in pharmacokinetic adverse drug reaction, you can study about absorption, distribution, metabolism and excretion. So, what are the drug interaction? What are the drug interaction with the absorption? What are the drug interaction with distribution, metabolism and excretion, which you can shortly call as ADMA. And next one was, according to its mechanism of action, next drug interaction was pharmacodynamic drug interaction. Pharmacodynamic drug interaction is again categorized into four types: agonist, antagonist, electrolyte and finally receptor site. And pharmaceutical mechanism of action, the drug interaction has been categorized into it is a physical chemical interaction when drug mixed with the intravenous infusion. If you had mixed the drug with an intravenous infusion, what is going to happen here? Here the going to causes the drug interaction. For example, if I am given the theophylline drug which will be interact with the succinylmethanium, which will causes the drug interaction. So, here dear students, here the drug interactions has been classified into three types depending upon its mechanism of action. One is pharmacokinetic drug interaction, second one is pharmacodynamic drug interaction and finally was pharmaceutical drug interaction. We will discuss one by one. In our syllabus it did not mention the pharmaceutical drug interaction. So, we will only focus on the pharmacodynamics and pharmacokinetics. So, next one we will move to the pharmacokinetic. Let us see what is a pharmacokinetic drug interaction and what is a pharmacodynamic drug interaction. Pharmacokinetic drug interaction, it will modify the pharmacological response by altering the concentration of a drug inside the tissue fluid, and which you can call as an ADME interaction. So, where you can discuss about absorption, distribution, metabolism and finally excretion. So, this is the reason why you can call as an ADME drug interactions. And what about the pharmacodynamic drug interactions? Pharmacodynamic drug interactions is an interactions which will modify the pharmacological response without altering the concentration of a drug inside the tissue levels. It do not alter the concentration of a drug inside the tissue levels. What about the kinetic? It will alter the concentration of a drug inside the tissue levels. This is the major difference between the kinetics and dynamic drug interaction. One of the interaction will alter the responses, which will alter the concentration of a drug to show the pharmacological modification, and one type of an effect is going without altering the concentration of a drug inside the tissue fluid. And first we will discuss about the drug interaction. So, here in this class we are focused about the pharmacokinetics and pharmacodynamics. We will see the drug absorption of we will see the pharmacokinetic absorption of pharmacokinetics like absorption, distribution, metabolism, excretion individually. So, this slide we are going to discuss about the absorption. So, what are the drug interaction you can see with the absorption, pharmacokinetic drug interactions with absorption. So, absorption alteration of pH will plays an important role in the drug interaction, alteration due to enzymes, complexation in absorption, alteration in ZI motility. If you are altering the absorption, it can definitely alteration of absorption is due to because of food. If you are taking the drug, if you are taking with the drug with the food, definitely it is going to alter the absorption. And finally, alteration due to the malabsorption. If the particular patient having the malabsorption, then it is going to affect the absorption. So, these are all the factors which are going to affect the absorption. And here first we will discuss about the alteration of pH. Here what is going to see here, the drug absorbed that must be in unionized form. So, the two things you have to remember, for the absorption the drug should be in unionized state, and the drug if it have to be eliminated from the body, it should be in ionized state. For absorption the drug should be unionized form, and for excretion the drug should be in ionized form. If the drug is unionized form, the drug cannot be eliminated from the body. So, by the metabolic process of phase 1 and phase 2, in phase 2 especially the drug is going to unionized drug is going to convert to the ionized drug, and finally the drug will be eliminated by the excretion process. So, in absorption what we will discuss here, the drug, if any drug have to absorb, it should be in unionized form. Acidic drug needs the acidic media, as the same way basic drug needs the basic media. For example, if I am taking the unionized drugs, so for example, unionized drugs having the rapid absorption. So, ionized drugs do not having the rapid absorption, you cannot see the absorption with the ionized drugs. So, for example, what is the alteration of pH? For example, itraconazole, antacids. You are taking the itraconazole. Itraconazole is an acidic drug. Antacid, it is a basic drug. So, if you are coming the acidic drug with basic drug, definitely it is going to alter the absorption. So, the acidic drug needs the acidic media, basic drug needs the basic media. Here you are giving the acidic drug in the basic media. So, what is going to happen here? You can see the alteration of pH. Next example was aspirin and antacids. Antacid is a basic form, aspirin is an acidic form, and definitely it is going to alter the pH, heparin and antacids. So, these are the examples falls under alteration of pH. Next one is complexation of any drug. Next one is complexation of any drug. What you can see here, complexation also affect the absorption by forming insoluble complex. Here how the complexation is going to alter the absorption, what it is going to do here, it will causes the insoluble complexes, it causes the insoluble complex. By the insoluble complex, what is going to happen here, the insoluble complex is not absorbed, right. So, if any drug has formed the insoluble complex, if the drug formed the soluble complex, that can be get absorbed, the insoluble complex cannot get absorbed. In a such a way, the complexation of a drug cannot causes the absorption. If any drug form the complexation which will leads to the insoluble complex can leads to the decrease in absorption. And what is the example falls here? Tetracycline. You have mixed the tetracycline antibiotic with antacid, which will causes the complexation and which will delay the absorption. And next one is tetracycline with iron. If you had combined the tetracycline with iron, then what is going to happen here? The absorption will be get delayed, which will causes the insoluble complex and which causes the decrease in absorption. Same way tetracycline, calcium and magnesium food, penicillamine, antacids, penicillamine with iron, ciprofloxacin with iron, ciprofloxacin with antacids. So, these are the few examples by where you had taken the one drug with the another drug, they are forming an insoluble complex which causing the delay of an absorption, which causes decrease in absorption. And next one is alteration in ZI motility. So, some drugs will causes alteration in ZI motility. For example, some drugs may affect the rate of absorption and some drugs may affect the extent of absorption. There are some drugs which will affect on rate, some drugs there are some drugs which will affect on extent, which will affect the extent of absorption. For example, if I had taken the paracetamol drug, it is an anisidase drug which I had mixed with the metoclopramide. So, I had taken the paracetamol drug with the metoclopramide. So, what is going to happen here? It will increases the absorption, right. And if I am taking the paracetamol with the propanthelene, what is going to happen here? The absorption will be get decreased. Dear students, listen here properly. So, one drug is going to affect the absorption with the another drug. So, if you are combining with these two drugs, the absorption has been increased. At the same time, if you had combined the paracetamol with the propanthelene drug, the absorption has been decreased. So, this is the alteration due to because of GI motility. GI motility alteration is GI motility. And next one, atropine and tricyclic antidepressants, opioid drugs reduces the gastric emptying delay in absorption. So, if you are taking the atropine drug or tricyclic antidepressant drugs or any opioid drugs, narcotic drugs, what it will do? It will causes decrease in gastric emptying delay in the absorption. So, this is the one of the factors that will alter in the GI motility. Next one, alteration in food. Alteration in food also is one of the factor that will alter the drug absorption. For example, if I am taking the isoniazid, linomycin, ampicillin, so tetracycline, what the drugs is going to do here? It will decreases the absorption. Itraconazole will increases the absorption. So, some drugs is going to increases the absorption, some drugs are going to decreases the absorption when you are taking with the food. So, if I had administered the itraconazole drug with the food, so definitely what is going to happen? You have to take the drug itraconazole, I had mixed it with the food, I had taken after the food the drug itraconazole, the absorption has been increased. At the same way, the isoniazid, lincomycin, ampicillin, I had mixed it with the food and I had taken the drug has shown decrease in absorption, because isoniazid is a drug which you have to take in the empty stomach. And next one was malabsorption. So, malabsorption, the laxatives can causes the malabsorption, result in decrease in absorption of vitamins. So, if you are taking any laxative drugs or we have to administer any vitamins, so what is the action? You can see the absorption of vitamins or nutrients on the GIT will be get decreased, right. The decrease of absorption you can see with the vitamins. And next one, alteration due to enzymes. So, due to because of some enzymes there is going to the alteration. For example, if you see the folic acid and phenytoin, phenytoin will decrease if you had administered the drugs. What the drugs here? Folic acid and phenytoin. If I had mixed in with these two drugs, I am taking the folic acid with the phenytoin drug, the phenytoin drug will decreases the absorption of folic acid. What is the reason behind this? Because phenytoin is an enzyme inducer. It can induce the enzyme, it will increases the metabolic rate of an folic acid. So, the folic acid will be get metabolized very fastly from the body and it will be eliminated from the body. So, if I am combining the drugs with the enzyme inducers like phenytoin, the action of any drug will be get decreased. And next one, pharmacokinetic drug interactions distribution. Definitely distribution will be plays an important role here. The distribution will leads to the drug interaction. For example, if you see in distribution, the drugs will be in a bound form and drugs will be in a free form. The drugs, if any drugs are in a bound form, it will shows less toxicity, and the drug is in a free form, it will shows more toxicity and more inaction, and free form will shows its action and more toxicity as well, right. And the drug present in bound form, it do not show any action or any adverse drug reaction, any toxic adverse drug reaction. So, what is the displacer drug? Here the pharmacokinetic drug interaction with the distribution. For example, these are the displacer drugs, these are the displacers. Okay. So, I had taken the salicylate drug, the salicylate drug has been displaced by the warfarin. So, what is going to happen? Increase the clotting time, right. And second one, displacer was an sulfonamide, displaced drug was an tolbutamide. Here the tolbutamide will be displaced by the sulfonamide, which will increases the hypoglycemic action. So, these are the few examples of displaced drugs with the displacers, and what the effect you can see, what the action you can see when the one drug is going to displaced by the another drug. Sometimes it will increases the action, sometimes it will be decrease in action, because one drug is going to displace the other drug, it will increases its toxicity. And next one, pharmacokinetic adverse drug reactions, metabolism. Now we had discussed about the absorption, distribution, and finally we are last but one, it is a metabolism. Here in metabolism we will discuss about the two terminologies, one is enzyme induction and second one is enzyme inhibition. What is an enzyme induction? Enzyme induction or enzyme inducers accelerate the metabolism and it will lead to the therapeutic failure gates and will shows decrease in effects. So, enzyme inducers, what the enzyme inducer will do? Enzyme inducers will increases the activity of a drug and it will decreases the effect of a drug. And what the enzyme inhibitors will do? Enzyme inhibitors will inhibit the metabolism of one drug to the another drug and it will increases the toxicity. So, here the drug cannot eliminate it from the body due to because of enzyme inhibitors. What the enzyme inhibitors are doing here? Enzyme inhibitor, for example, one drug, it is an enzyme inhibitor. The one drug of enzyme inhibitor is going to inhibit the action of another drug. So, the another drug cannot get metabolized in the body and it cannot eliminate it from the body fastly and which can causes the toxic levels in the body. Here the some of the drugs like inducers, and the next slide I will explain about the inhibitors. So, these are the inducers, for example, these are the enzyme inducers. So, these are the examples which falls under enzyme inducers, barbiturates, glycinoflavin, smoking, pyridoxine, phenytoin, rifampicin, carbazepine, all these are the drugs are the inducers. So, these drugs will induces the metabolism of these drugs, contraceptives, warfarin. So, for example, here I had taken the barbiturate with the oral contraceptives. Barbiturate is an enzyme inducer. It will induces the action of any oral contraceptives and the effect of oral contraceptives will be get decreased. Okay, next one, glycinoflavin. The glycinoflavin, if I had administered the glycinoflavin with the warfarin drug. So, glycinoflavin is an enzyme inducer. When you had taken the enzyme inducer with warfarin, the warfarin will be get eliminated very fastly. So, its anticoagulant action. So, if it eliminated fastly from the body, the anticoagulant action will be get decreased. In the same way, barbiturate with glucocorticoids. So, glucocorticoids is used in anti-inflammatory condition. So, if you had administered the barbiturate with the glucocorticoids, here the glucocorticoid action has been decreased. So, the anti-inflammatory action has been reduced. So, by this slide I have to conclude here. So, when you had taken the drug with the enzyme inducers, definitely the action of a second drug will be get decreased. And what about the inhibitors? So, enzyme inhibitors, this is about the enzyme inhibitors. So, what are the enzyme inhibitors? Allopurinol, disulfiram, isoniazide, chloramphenicol, cimetidine, ethanol, ketoconazole, erythromycin, all these are the enzyme inhibitors. If you had taken the drugs with the enzyme inhibitors, so what the drugs you are taking with the enzyme inhibitor? For example, allopurinol. Allopurinol is a drug which falls under enzyme inhibitor, and if you had taken the allopurinol with the tolbutamide. So, what is going to happen here? Increase hypoglycemic action. Why it will be increased hypoglycemic action? Because it is an enzyme inhibitor, it cannot inhibit, it cannot fast up the metabolism of an tolbutamol. So, the more time the tolbutamol drug will be stay inside the body and it will be increase the action. At the same time, the drug did not get metabolized from the body. At the same time, the drug can causes the toxicity as well. So, disulfiram, these are the rest of the examples. Disulfiram, when you had administered with the tolbutamol, what is going to happen? Increases the hypoglycemic action. The isoniazide, if I am administered the isoniazide, it is an enzyme inhibitor. I had given with the oral contraceptives. So, the action of an oral contraceptives will be get increased. Chloramphenicol with probenecid. If I am given the chloramphenicol with the probenecid metabolism will be get decreased because I had given with chloramphenicol. Chloramphenicol is an enzyme inhibitor, and the what action you can see here? Increase the gout action. So, actually probenecid is a drug which is used in a gout disorder. So, it increases the anti-gout action, right. And next one, pharmacokinetic drug interaction with excretion, the last part of a pharmacokinetic drug interaction. So, urinary pH will plays a very important role in excretion. Depend upon the urinary pH, the drugs will be seen that what the drugs can be excreted or not. Unionized drugs will be absorbed fastly and ionized drugs will be eliminated fastly, and unionized drugs cannot eliminate it fast. Unionized drug cannot eliminate it from the body. In elimination, In elimination, if the drug is in acidic state, we need the basic media. So, what is going to happen in absorption? Acidic state, so acidic drug needs the acidic media and basic drug needs the basic media. But in case of excretion, here acidic drug needs the basic media, basic drug needs the acidic media. And here one more difference of an absorption and excretion: unionized drugs will get absorbed very fastly, ionized drugs will be get eliminated very fastly. And if you see here, the salicylates and phenobarbital both are acidic drugs. Which type of, for example, if I am taking the aspirin or salicylates or phenobarbital, these are the acidic drugs. So, what the media they need? It need the basic media. So, it needs the basic pH of urine. So, to here what you have to do here, you have to introduce the sodium bicarbonate. So, what is a sodium bicarbonate? Sodium bicarbonate is a basic media. So, what the drug is given here? Salicylate. Salicylate is an acidic drug. To eliminate the drug from the body, acidic drug needs the basic media. Here the acidic drug was salicylate, and what the basic media I am introducing here? Sodium bicarbonate. So, here the acidic drug with the basic media can be eliminated fastly from the body. And the second example was amphetamine and quinidine. So, okay, amphetamine, it is a CNS stimulant drug, quinidine is an antiarrhythmic drug, both are the basic drugs. Okay. So, just before I had said you, the basic drug needs the acidic media. So, what will introduce here? We will introduce the ascorbic acid. So, ascorbic acid is an acidic media. So, the basic drugs we will introduce the acidic media to eliminate the drug. So, this is a chart by where you can see the pharmacokinetic drug interaction. So, pharmacokinetic drug interaction, which you can call as an A, this is an A D, this is an A M, and this is an A E, and which you can solve the absorption, distribution, metabolism and excretion. Absorption you can see in the GIT, the drug food alter the absorption of another drug. If you are taking the drug with the fruit, definitely it will causes the alteration of another drug, which will be happens in the GIT. Second one is distribution, which you can see with the blood. Here what is going to happen? Depending upon the drug binding, which drug is going to displace and which drug is going to be displaced by the other drug, according to that the action will be get increased or decreased. And next one, liver. In liver we had discussed about the enzyme induction and enzyme inhibition. Some drugs can causes the enzyme induction with the other drugs. So, the action or the effect of a drug will be get decreased. And what about the enzyme inhibitors? Here the action will be get increased because of decreasing metabolism of a second drug. And where the enzyme induction and inhibition you had been observed? In the liver. And last one of the pharmacokinetic drug interaction was excretion. In excretion, what the things I had highlighted you here? Here the basic drugs needs the acidic media and the acidic drug needs the basic media to eliminate the drug from the body. And now we will discuss about the drug interaction in the pharmacodynamic level. Okay, in pharmacodynamic, adverse drug reaction has been categorized into agonist, antagonist, receptor site or electrolytic balance. These are the four things we will discuss in the pharmacodynamic drug interaction. In pharmacodynamic drug interaction, we will focus on agonist, antagonist, receptor and finally an electronic imbalance. First we will discuss about the agonist drugs. So, what the agonist drug and what is the effect of a pharmacodynamic action. So, here the agonist drug warfarin, aspirin. You know that warfarin is an anticoagulant drug. Which type of anticoagulant it is? It is an oral anticoagulant, and heparin will falls under the parenteral anticoagulant. So, if I am taking the warfarin with the aspirin, aspirin also having the anticoagulant activity. So, if I am taking the warfarin with warfarin with aspirin, it will increases the coagulant action, right. And second one is alcohol with sedatives. Alcohol also having the sedative action. If I am taking the sedative drug, what is going to happen? Here the agonist drugs with the another drug will going to increase the action of a second drug. And next one is antagonist drug. Here one drug is going to decreases the action of another drug. For example, here the thiazide diuretics, insulin, okay, salbutamol, beta blockers, Okay, opioids, naloxone, acetylcholine, atropine. So, one drug is an agonist and we are taking the antagonist drug. Here the thiazide diuretics with the insulin, it can antagonize the action. Salbutamol is an drug which we are combined with the beta blockers, right. Opioid and naloxone, acetylcholine, atropine, histamine and adrenaline. So, it will shows the antagonist action. And what is the electrolyte changes you can see here? While changing the level of electrolytes, it can affect the pharmacodynamic levels. For example, students, here the cardioglycosides, what is going to do here? The heart becomes more sensitive. In cardioglycosides, the heart becomes more sensitive, and when you are administering with the diuretics, which will causes the potassium channel, which results in arrhythmia. Okay. And next one, diuretic drugs which will decreases the sodium, when you had administered this drug with the lithium, which will causes the toxicity. And next one, receptor site, the interaction with the receptor can be beneficial and sometimes it can be harmful. When the drug bind to the receptor, sometimes it is beneficial and sometimes it will be harmful. So, by here I had completed the entire drug interactions, which includes the pharmacokinetic drug interaction and pharmacodynamic drug interaction.